Laura Hernan will present how to perform a standard echocardiographic examination with all the 2D and M-mode acquisition in normal subject. She will first start by showing the standard and modify transducer positions to obtain all the echocardiographic views, and she will finish off by the M-mode tracings and principles.
So I will present you the standard transthoracic examination. We will start with the 2D acquisitions and then we will move to the M-mode views. So we will start by checking and recording the height and the weight of the patient in order to be able to do an indexation of the parameter that need indexation. And I will take before the exam the blood pressure in order to be able to evaluate the afterload of the left ventricle before to start. And of course I need a beautiful ECG recording during all the exam and to start the patient in the left lateral decubitus position. So we will start with the parasternal long axis view, which is the first view to acquire. So my probe will be next to the sternum here, and I will have the marker that is in the direction of the right shoulder of the patient. So I will try first to put the patient a little bit more like in the decubitus in order to have the aorta very beautifully seen, and I need to be very up in the intercostal space in order to have a beautiful view of the aorta, which is here. So we can see in this view the cusp, the aortic cusp with the right cusp and the posterior cusp, and then I have all the beginning of the aorta with the sinus, the valsalva sinus, the junction, the sinutubular junction, and the proximal aorta. Then I will focus my view. I will be a little bit down here in order to focus my view on the left ventricle and on the mitral valve. So when I'm here, I'm able to see, I will try to have the cursor, I'm able to see still the aortic valve, but also the left atrium, the mitral leaflet with the anterior leaflet and the posterior leaflet. Here I have the right ventricle, it's the inflow part, the outflow part, sorry. And here I have the septal wall of the left ventricle and the inferior lateral of the left ventricle. So I'm appreciating the morphology of the valves and also the wall motion of the left ventricle. And I can also put my probe a little bit, to tilt it a little bit down in order to see the posterior part of the mitral valve and the anterior part on the other side. So I'm able to see the morphology of the valve and to appreciate it very carefully. So the next view is, oh, I forgot to say that there is also the aorta that we can see here. We can see the aorta, the descending aorta here. So now I will try to obtain a short axis view. So I am putting the transducer, I'm rotating the transducer 90 degrees. So now the marker is going to the direction of the head of the patient. And I will try to obtain a view that is focused on the aortic valve. So the first acquisition is an acquisition that is focused on the aortic valve in order to be able to see the morphology of the valve, if it's a normal valve which is tricuspid, or if it's a bicuspid valve, or if there is abnormalities, and we need to do that in a systematic way. So I am appreciating the morphology of the valve. I'm trying to see the three cusp. You have the right cusp here, the posterior cusp here, and the left cusp here. Now I will try to obtain a view that is more focused on the pulmonary valve Here is the right ventricle, here is the tricuspid valve, here the right atrium, and here the pulmonary artery. Now I will try to move a little bit next to the sternum in order to have a view that is more focused on the pulmonary valve. So I'll try to push my patient up. And in order to be focused, I will diminish the depth. And here I'm able to have beautifully the morphology of the pulmonary valve. Okay, and now I will try to obtain another view which is more focused on the tricuspid valve. So you can see here the septal leaflet of the tricuspid valve and the lateral leaflet. And here you have the interarterial septum between the left atrium and the right atrium. So now let's move on. We have to now appreciate the morphology of the mitral valve, and I will try to tilt my sound this way and to focus on the mitral valve. So here, on this view, I will see the right ventricle, the left ventricle, which is in a short axis view, and the mitral leaflet with the anterior leaflet and the posterior leaflet. So I am appreciating the morphology of the leaflet. Now I will move a little bit more toward the apex, and I will see, just by tilting a little bit my transducer, I will see the short axis view at the level of the papillary muscles. You can see the papillary muscles here, and I will appreciate the wall motion of all the left ventricular wall. And now I will move a little bit more toward the apex, just by tilting a little bit, and I will decrease the depth, trying to increase the gain, and I will obtain a beautiful view of the apex of the left ventricle, and I'm able to appreciate also the wall motion of the apical part of the left ventricle. So now, in order to assess a little bit more the right ventricle, I will try to obtain a view that is a parasternal long axis view that is focused on the right ventricle and on the tricuspid valve. So I am still in the parasternal long axis view, and I will tilt this way the probe, and I will obtain a beautiful view of the right ventricle. And this is the only way actually to see the posterior leaflet of the tricuspid valve that you can see here. I can see here the anterior leaflet, and there is the anterior wall of the right ventricle and the inferior wall of the right ventricle. Of course, here is the right atrium, so I will try to decrease the depth in order to be able to really see the morphology of the tricuspid valve. So now we will try to obtain the apical views. So for that, I will put my transducer here with the marker that is down. So I will try to obtain a standard view. So we have to avoid the foreshortening of the apical view, and the foreshortening is when you are here too up in the intercostal space, and you can see here that the four cavities are a little bit truncated, and in order to obtain a standard view, you have to be really, really down in the intercostal space. So first, I will appreciate the four cavities. So I will try to appreciate the left atrium here, the mitral valve, the left ventricle, here the right ventricle, and the right atrium with the tricuspid valve. So the first thing that I will try to obtain, it's a view that is focused on the left atrium in order to measure the left atrial volume. Then I will decrease the depth and try to focus on the left ventricle. It's the right view to assess the left ventricular volumes in order to calculate the left ventricular ejection fraction in a biplane mode. So I will appreciate here the inferoseptal wall and the anterolateral wall of the left ventricle. And here I can also appreciate the anterior leaflet of the mitral valve and the posterior leaflet of the mitral valve. So now I will increase again the depth, and I will try to focus my view on the right ventricle. And I will try, in order to do that, to be a little bit more external with my transducer. And then I will decrease the depth in order to obtain a beautiful view of the right ventricle with the lateral wall of the right ventricle and the tricuspid leaflet here. Then I can increase again in order to be able to measure the right atrium, the area or the volume here. Now, I will try to obtain a 5 apical chamber view. So for that, I will just tilt a little bit my probe, and I will obtain a view with the aortic valve and, of course, the left ventricular outflow tract. And I will be able to acquire a Doppler and to evaluate the aortic valve. So now we will try to obtain an apical 2 chamber view. So in order to do that, I will try to have a standard 4 chamber view and then to turn my transducer with the marker that will be in the direction of the shoulder of the patient, and I will move just a little bit in order to obtain the standard apical 2 chamber view. So here I'm able to appreciate the left atrium. I can use that view in order to assess also the left atrial volume. I see the mitral valve, and you have to see the 2 papillary muscles in order to be sure to be in a 2 chamber view. You have the anterior wall of the left ventricle and the inferior wall of the left ventricle. So then I will decrease the depth in order to focus on my left ventricle. So I can see here very, very nicely the left ventricle, and I will appreciate the wall motion of the anterior and inferior wall. And I will be also able to measure the left ventricular volume in order to assess in a biplane way the left ventricular volumes and ejection fraction. So next, I will try to obtain an apical 3 chamber view, and for that, I will turn my probe with the marker that will be in the direction of the right shoulder. I will move just a little bit in order to center the left ventricle, and here I can see the left atrium here, the anterior mitral leaflet, the posterior mitral leaflet. I can see here the aortic valve with the anterior cusp and the posterior cusp, the right cusp, sorry. And I can see here the anteroseptal wall of the left ventricle and the inferolateral wall of the left ventricle. So I will appreciate the morphology of the valves, but also the wall motion. And in order to assess the wall motion, I will decrease the depth and again focus on the left ventricle. Then, in order to be able to describe the morphology of the mitral valve very carefully, I will just tilt in the direction of the posterior commissure and then in the other way. So I'm screening all the plan of the mitral leaflets. Okay. So now we will move on with the subcostal views. So I will put the transducer just behind the xiphoid. And I will try to obtain first a view of the inferior vena cava. So I will ask the patient to take an inspiration and to breathe. So here, so breathe normally for the moment. Here I will obtain the vena cava that you can see here. Next I will move to a 4-chamber view, a subcostal 4-chamber view. So breathe and stop a bit. Perfect. So I will increase the depth. And you can see here a 4-chamber view with the interatrial septum here. You can see here the tricuspid valve, the right atrium, the right ventricle, and here the left ventricle and the left atrium. So breathe. And I will try now to obtain a short axis subcostal view. So I will turn the marker that will be up. And by tilting, I will obtain a view that is focused on the aortic valve that you can see here. Breathe a bit. Okay. Okay, relax. Try to. So here is the aortic valve. Here is the tricuspid valve with the right atrium and the right ventricle. If I move a little bit the transducer, I will obtain the pulmonary valve and the pulmonary artery here. Okay, then, so you can breathe. Then I will tilt a bit the transducer in order to obtain a short axis view of the left ventricle. Here. So I will ask you to breathe again and stop. So here is the left ventricle at the papillary muscle level. And then I will move a bit and tilt, and I will obtain an apical view of the left ventricle in short axis. If I move this way, I will go more to the mitral valve. And then back to the 4-chamber. Okay, so now let's see the suprasternal views. So I will ask the patient to put the head like this. My marker is in direction of the head of the patient. I am decreasing the depth in order to focus on the aorta. Decreasing the depth again. So here is the aorta. You have the cross here and the descending part of the aorta So I will be able, in this view, to measure the diameter of the cross of the aorta and the descending part if I'm moving a little bit in order to have a bit better view of the descending part. I will be able to measure the diameter of the descending part of the aorta. Here, if I'm moving a bit too, I'm able to see the ascending part. Okay. So now we will see the M-mode acquisition that is not really very often used these days, but can be still useful in some situation. And I will try to show you how to acquire the standard M-mode acquisitions. So we will go back to the lateral decubitus position. And I will start with the parasternal long axis view. I will go back to the view. And in this view, you can acquire a M-mode that is on the, I will push you a bit. I will try to obtain a M-mode on the aortic valve and the left atrium. You need to be perpendicular to the aortic valve in order to obtain that view. And you will be able to see the aorta here, the aortic cusps that are opening and closing here. And here is the left atrium. I have to say that it's not recommended anymore to assess the left atrial dimension this way. So now I will try to obtain a M-mode on the mitral valve. So I put my cursor in the direction of the perpendicular to the mitral valve. And I will see the two leaflets. So here you have the septal wall, the inferolateral wall of the left ventricle, and here is the anterior leaflet of the mitral valve. You can see the E and the A wave, and here the posterior leaflet of the mitral valve, closing here. Now I will try to obtain an M-mode of the left ventricle in order to assess the diameters and also the left ventricular thickness. So I will try to have my cursor that is really perpendicular to the long axis of the left ventricle, and the position of the cursor needs to be at the tip of the mitral leaflet in order to have really a standardized view and in order to be able to compare the measure that I have with the reference values. So sometimes I have to push my patient and to be a little bit closer to the sternum. So now I will have the M-mode acquisition. Okay, so you can see that I'm really perpendicular to the long axis of the left ventricle, and I am really close to the tip of the mitral leaflet that I can just see a little bit here. And I have here the septal wall of the left ventricle. Here you can see the diameter in diastole, here in systole, and here is the inferolateral wall of the left ventricle. Okay, so now let's move on. So in short axis view, there is not a lot of, I can acquire sometimes a M-mode, but it's not currently recommended to have a M-mode of the aortic valve or the mitral valve, so now it's not recommended anymore. So I will try to move on the apical view again in order to assess the tricuspid annular excursion and the mitral annular excursion. So it's a way to assess the right atrial function, the tricuspid annular systolic excursion, and it's really dependent on the angle that you will do the acquisition. So I try to obtain a view that is a 4-chamber view, but with all the right ventricle that is well seen, and I will put the cursor really at the junction of the, here you can see it, at the junction of the lateral right ventricular wall and the right atrium, and I will do the acquisition like this. Sometimes I have to increase the gain. So here you can see the excursion, the systolic excursion, and I will measure from here to here in order to obtain the systolic excursion of the tricuspid annulus, so the TAPSI. On the mitral side, I will do absolutely the same, but at the mitral annulus, and I will obtain the MAPSI. So here I'm really careful to be at the junction, and I will do the M-mode acquisition. Okay, and I can also assess here, measure here, the systolic excursion of the mitral annulus. Okay, so now let's move to the subcostal view, so I will ask you to go again here. The last acquisitions that I can do in M mode, so I put again the marker this way. Sometimes I can assess the diameter of the inferior vena cava with a M mode. I have also to be really perpendicular to the axis of the vein. So now I'm perpendicular and I will do the acquisition. And I will be able to measure the diameter at end expiration and inspiration. And the last thing is that you can do, but there is a lot of issue about reproducibility. You can do a M mode of the right ventricular wall in order to assess the thickness of this wall. But the problem is really the reproducibility. So in theory, you have to be also really perpendicular to the wall, so you can do it or with the transducer here or here. But for me, it's easier like this. And I have to be really perpendicular. And to have an M-mode acquisition here, we'll increase the gain. And you can see here the right ventricular wall, and you can assess the thickness, always thinking that the reproducibility is difficult because this wall is really thin. So we've seen all the standard views that you have to acquire for every exam, every time, and I hope it was helpful for you.